What's the deal with vitamin D toxicity? You might have heard about the importance of vitamin D for our overall health. It's often called the sunshine vitamin because our bodies produce it when exposed to sunlight. But what happens when we get too much of it? Can something so beneficial turn harmful? Let's dive deeper into the world of vitamin D and uncover the hidden dangers of oversupplementation. And should you be worried about your supplements? Let's break it down. Vitamin D plays a crucial role in maintaining healthy bones and supporting our immune system. It's found in certain foods like fatty fish, fortified dairy products, and egg yolks. However, many people turn to supplements to ensure they get enough, especially during the winter months when sunlight is scarce. But how much is too much? Vitamin D is essential for our health, but more isn't always better. While it's true that vitamin D deficiency can lead to serious health issues like rickets in children and osteomalacia in adults, oversupplementation can be just as dangerous. The key is finding the right balance. Our bodies need vitamin D to absorb calcium, which is vital for bone health. But when we consume too much vitamin D, it can lead to an excess of calcium in our blood, a condition known as hypercalcemia. Vitamin D toxicity, although rare, happens when you consume too much from supplements, not from food or sunlight. Our bodies have a natural way of regulating the amount of vitamin D produced from sunlight, and it's almost impossible to get too much from food alone. However, supplements can easily lead to an overdose if not taken correctly. This is why it's crucial to follow recommended guidelines and consult with a healthcare professional before starting any new supplement regimen. So, what's the big deal? Why should we be concerned about vitamin D toxicity? The symptoms of vitamin D toxicity can be quite severe and can significantly impact your quality of life. Early signs include nausea, vomiting, and weakness. These symptoms can be easily overlooked or mistaken for other health issues, making it important to be aware of the potential risks associated with high doses of vitamin D. Too much vitamin D leads to calcium buildup in your blood, causing nasty symptoms like nausea, vomiting, and weakness. But it doesn't stop there. If left untreated, hypercalcemia can lead to more serious complications such as bone pain, kidney stones, and even kidney failure. The excess calcium can deposit in your kidneys, leading to damage and impaired function. This is why it's essential to monitor your vitamin D intake and be mindful of the dosage. If ignored, it can even result in bone pain and kidney issues. Yikes! Imagine experiencing constant pain in your bones or dealing with the discomfort of kidney stones. These are not just minor inconveniences, they can severely affect your daily life and overall well-being. It's important to recognize the signs of vitamin D toxicity early and take action to prevent long-term damage. How much is too much? This is a common question, and the answer can vary depending on individual needs and health conditions. The recommended daily allowance, RDA, for vitamin D is 600 IU for most adults, but some people may require higher doses to address deficiencies. However, taking 60,000 IU of vitamin D daily for several months can lead to toxicity. It's crucial to find the right balance and avoid excessive doses. Taking 60,000 IU of vitamin D daily for several months can lead to toxicity. This is far beyond the recommended amount and can have serious consequences. It's important to follow the guidelines provided by healthcare professionals and not to self-prescribe high doses of vitamin D. Oversupplementation can be tempting, especially when we hear about the benefits of vitamin D, but more isn't always better. Compare that to the recommended 600 IU per day for most adults. This amount is generally sufficient to maintain healthy levels of vitamin D in the body. For those with specific health conditions or deficiencies, a healthcare provider may recommend a higher dose, but it's important to do so under medical supervision. Regular blood tests can help monitor your vitamin D levels and ensure you're not exceeding the safe limit. If you're treating a deficiency, always consult your doctor and get regular blood tests. This is the best way to ensure you're getting the right amount of vitamin D without risking toxicity. Your doctor can provide personalized recommendations based on your health needs and monitor your progress over time. It's also important to discuss any other supplements or medications you're taking, as they can interact with vitamin D and affect its absorption. Remember, when it comes to vitamin D, balance is key. A balanced diet that includes vitamin D-rich foods, regular exposure to sunlight, and appropriate supplementation can help maintain optimal levels. It's not just about taking supplements. It's about a holistic approach to health that considers all sources of vitamin D. By being mindful of your intake and following medical advice, you can enjoy the benefits of vitamin D without the risks of toxicity. Stay safe and keep shining. Embrace the sunshine, Enjoy a healthy diet and be cautious with supplements. Your health is worth it. By understanding the potential dangers of oversupplementation and taking proactive steps to avoid them, you can ensure that vitamin D continues to be a positive force in your life. So get outside, soak up some sun, and remember to keep everything in balance. Your body will thank you.